Hello, everyone. Hi, my name is Steve Hoffert. I'm with Magnolia Pharmacy, and I want to thank you very much tonight for joining our webinar on the endocannabinoid system and the understanding the role that hemp and compounded cannabidiol products can play in your health. I also want to introduce tonight my host that's going to be joining us, my sales and marketing director, Haley Calavo. Very grateful to have her join. She's going to kind of mediate for us tonight to allow us to be a part of the event. So thank you very much for joining us. This is kind of a fun event for me because we've asked not only a lot of our doctors and medical professionals that we serve every day at our pharmacy, but we've also asked a lot of patients to join us. And I think it's important because today's society is so educated on health and doing the right thing for wellness. And this whole endocannabinoid system is the perfect place where a merge between science has come today. And so I'm really excited to have you join us tonight. We look forward to having you be here. I will tell you too, we hope you can stick around for the whole event because at the very end, if you stick around for the entire attendance, you will be entered in a drawing for a $300 gift basket of some over-the-counter, high-quality hemp CBD products. So we hope you can make it for the whole time as far as that goes, and we want you to join us. Let me get started with the presentation, and we'll talk about some of the details as we move forward. The right screen up. Awesome. So the first thing that I want to talk about tonight is tonight's presentation is something I enjoy. I've spent a lot of time putting it together. And the one thing that I want you to realize about this presentation is that there's a lot of information. The whole endocannabinoid system is very new. So with that said, I also want to state the statements made in this presentation have not been evaluated by the Food and Drug Administration. Information is offered is not intended to diagnose, treat, or cure, or prevent any disease. This information is for your educational purposes only and is not meant to replace the advice of your physician and healthcare practitioner. So I just want to kind of get those details out of the way. Tonight's event really is all about you. I cannot stress that enough. So as we go along tonight, we're going to stop a couple times and we want your questions and comments. So if you can, write down this number, 281-305-7276. If any time during tonight's presentation you have questions, we ask you to submit those via that number. We'll receive them as a text. We will stop and answer your questions at several points through this presentation. Like I said, this is all for you, so please don't hesitate to ask as many questions as you want because there's probably is a lot to learn as far as that goes. So that's the one thing that I'll say as far as we go. So once again, that number is 281-305-7276. Let's get on with our presentation now. So starting out with the endocannabinoid system, I want you to understand it's probably one of the most primitive systems in our body. And what's really kind of unique about the endocannabinoid system is it's relatively new. I'll tell you, when I was in pharmacy school, we weren't educated about the endocannabinoid system. We talked about our own cannabinoids, but that was really about it. The other thing I want to stress is that many medical practitioners, just like myself, even today in school, this is not taught much because you have to keep in mind the relatively science aspect of the system wasn't even really understood until about the 1990s. And we'll talk a little bit more about the history of it. So what I want to stress is we are still in the infancy of learning about this system. But the main thing is we are born with this. It's one of the first receptor signaling systems that forms in the womb of an infant. And it isn't just found in humans, it's found in all humans and animals. And the way I like to explain it is it keeps a balance. It maintains the homeostasis between our internal environment, what's going on in our bodies, and the world around us. And the way I like to look at it is it regulates our external stimulus. And what's really unique about it is it really doesn't have a lot of direct effects on things, but it sends signals. And so it has signals to affect not only in a positive way, but a slowdown way of our neurotransmitters. It also has the ability to help us remember the things our body needs to remember, but also forget the things that are not relevant to us. And if you keep in mind, it was explained once I heard, it really works in the way that we relax, in our ways we eat, the ways we sleep, the things we forget, and our protection mechanism in terms of our immune system. So you can see it greatly affects a number of different systems in the body. It crosstalks with all the other organs. Almost every single organ in the body has these receptors, these endocannabinoid receptors that allows it to talk to organs in the body. One of the things we're beginning to learn is we can have endocannabinoid, which endo means within our own bodies. Endocannabinoid deficiencies can be linked to things like fibromyalgia, irritable bowel syndrome, migraines, and failure to thrive in infants. And I always like to throw this out. What are things you can do to help produce your own endocannabinoids? And those are things like exercise, diet, believe it or not, consuming dark chocolate, and stress reduction techniques are all very, very beneficial in terms of helping us to produce our own endocannabinoids. So the next thing I want to talk about, we've learned a lot over the last few years in terms of the receptors in our body. So many of us know about insulin. And we talk about when we were in pharmacy school, and many doctors in medical school, and even you as a lay public need to understand our bodies have receptors. And receptors are like the lock in a door. And then we have things that fit in this lock, and those are typically hormones or different type of neurotransmitters, or even things like our endocannabinoid system. It's a lock and key system. We have some things that go in the lock and cut it on. We have some things go in the lock and lock it up. But what's really unique about the endocannabinoid system, when we think of something like insulin, insulin fits in the receptor and basically cuts it on. It's either on or off. The endocannabinoid system really is not like that. It's a special type of receptor that doesn't just cut on. It isn't an on-off effect. It actually has the ability to cut on a signal and then make those things around it do other things. So it's kind of like a signal sending type receptor. So the main two that we know about, and there's others, and we'll talk about that, is what's called the CB1 receptor, which, to make things simple for tonight, is mostly found in the brain. And it's what calls the psychotropic or the psychoactive effects of hemp or CBD, most specifically hemp and THC. And when we think about the CB1 receptor, when it's stimulated, we see things like decrease in anxiety, reduced pain, decreased inflammation. It controls our sensory perception in terms of it may allow us to relax so we don't overtake in our environment and become stressed. It helps with memory. It can control appetite, and it can basically affect our cognitive function. And we have found that things like poor diet, processed foods, stress can actually overstimulate the CB1 system and cause a negative effect, which are things like anxiety, paranoia, inflammation, and insulin resistance, and poor sleep. So keep in mind, like I told you, this isn't an on or off effect. We want to stimulate this receptor to a good way. If we overstimulate it, we can get a negative consequence. So think in mind, CB1 receptors, mostly in the brain. It's the psychotropic effects of what we think in terms of THC or marijuana. The CB2 receptor is found mostly in the periphery. What does that mean? It's found in the organs and the tissues throughout the body. What we've learned is there's a cross reaction to both. There's a little bit of CB1 in the periphery, and there's a little bit of CB2 in the brain. But for tonight, to keep things simple, CB2 is what's found in the body, and it's big in controlling our immune response. All our immune cells have some type of a cannabinoid receptor on them, and it's typically a CB2, and these are involved in controlling inflammation. So keep in mind, there's two main receptors, CB1 and CB2. So if we have receptors in the body, it's pretty unique. We make substances then that can stimulate these receptors. We have found two main endocannabinoids, and I want to stress that. Endo means within the body's cannabinoids. We make these. The first one that was ever found was called anandamide. And what's pretty unique about it is it naturally hits the CB1 and CB2 receptor. So if you go back and look, and we talk about it, and I'm going to grab my little pointer real fast. If you go back and look at this, hold on just a second. Grab this spotlighter. If we go back and look at the previous slide, when we hit the CB1 receptor, we're going to get these benefits of reduced anxiety, pain, decreased inflammation. So in terms of what we're looking at, let me go to the next screen. The anandamide is able to hit the CB1 receptor and the CB2 receptor. And that's one of the ways our body naturally affects that receptor. The other big endocannabinoid our body makes is something called 2-AG. It's 2-arachidonoglycerol, and it's also an endocannabinoid, and it also plays on the CB1, and it's naturally found in the body. The unique things about our endocannabinoids are our body does not make these and store them somewhere, so when we need them, we can produce them. What we do is we produce endocannabinoids on demand. And what's really so that's really unique. Our neurotransmitters in our brain are stored in vesicles. So when the body needs to respond to the external stimuli, our body can release neurotransmitters when it needs to and put those out for them to work. Endocannabinoids are like this. Our body, when it feels like it needs to put things in balance, like we talked about, endocannabinoid systems puts things in balance. The endocannabinoid system on demand produces these endocannabinoids from something called arachidonic acid. They're little fatty acids in our body. And there's a lot of things that can affect that. And that's one of the reasons why things like stress and poor diet and sleep and micronutrient depletions and drugs can deplete our ability to produce these endocannabinoids on demand. So that's what's important to keep in mind as far as that goes. So those are our two main endocannabinoids. So let's talk about, we talked about the receptor. We talked about what the body makes to fill that receptor on our own. Now we're going to talk about what are called phytocannabinoids or cannabinoids that are produced in a lab. So we have this system in our body, and what we have learned through the years is, and for many, many years, Cannabis sativa is a plant that produces what are called phytocannabinoids. Phyto means plant. They are from the plant. It produces phytocannabinoids that can bind or act upon our own natural endocannabinoid receptors, or it may allow the body to better use our own endocannabinoids in that system. So this plant has the ability, and it produces out basically what are called phytocannabinoids. And believe it or not, in the full hemp plant, there's about 140 different cannabinoids. And then there's also called terpenes that are in there that have some medical benefits that are in this Cannabis sativa plant. What makes it unique is the same plant that is medical marijuana, the same plant that is recreational marijuana, and the same plant that's agricultural hemp that we actually get the over-the-counter hemp CBD products from. They're all the same plant. Keep that in mind. It's the way it's grown, it's the environment it's grown in, it's some of the manipulations to how the plant grows, what makes it from agricultural hemp to medical cannabis to recreational marijuana. So I want you to understand that. So like the next part here shows is medical cannabis basically is grown and has a higher THC content. So tonight, there's, like I told you, there's 140 different phytocannabinoids we could talk about. We're going to spend most of our time talking about CBD and THC. THC, we all know what that is. It's got the rap. It's the one, it's basically recreational. It can be abused. Believe it or not, some THC, cannabis sativa is grown with really high levels of THC to the point it can overstimulate that CB1 receptor and cause anxiety and stress and paranoia. And so that's the THC part. And then there's also CBD, which is the other thing. And those are the things we're going to talk about. Medical cannabis is grown to have a high THC content, anywhere between 8 to 10% and sometimes even higher. So we're looking to get a large amount of the medical cannabis or the medical THC, and we'll talk about what that effect that has on the body. Agricultural hemp or industrial hemp is the same plant grown in a different way, but as you can see, it has less than 0.3% THC by dry weight. So keep in mind what I just told you. The same plant's grown, if it's grown one way, it can have 8 to 10% of THC, medical marijuana, and even higher for recreational. If we want to grow it to sell it as an over-the-counter product, and what's important about that as an over-the-counter product, we need to keep in mind that it has to have less than 0.3% THC. We'll talk about that has an effect on the over-the-counter products. But one of the things to keep in mind is that 0.3% THC, it has a little bit of THC, but there's not enough THC in those products that are produced properly to make you high, give you the munchies, or cause any kind of issues in terms of overdosing or getting THC in your system like you would think if you smoke marijuana or even use medicinal marijuana. And keep in mind that hemp plant, like you said, is the same as the medical marijuana. One of the really unique things that we as compounders have got the ability to do And in case you don't know what compounding is the art and science of being able to take medications and customize for customized solutions when people struggle with things. Sometimes children can't swallow pills, we can make liquids. Sometimes a person can't swallow a pill, so we find a way to deliver it across the skin. Sometimes we combine different medications together to get a synergistic effect to treat certain medical conditions. We as compounding pharmacists now have the ability to have a pharmaceutical grade synthetic cannabidiol. And what's really unique about cannabidiol in a synthetic form, it's ultra pure. It is not produced from the hemp plant. It's actually made chemically in a lab from limonene, which is one of the terpenes that's actually found in hemp. So it's non-hemp based. It is pharmaceutical grade, high purity. When it's produced, because it doesn't come from a hemp plant, it has to have less than 0.1% THC. So if your over-the-counter product can have up to 0.3% THC, these high-quality pharmaceutical synthetic CBD cannabidiol that we purchased a compound with has even less than that. It has to have less than 0.1, and I can tell you, I've looked at some of that we've gotten in so far, and it actually has less than 0.05. Very, very pure. It is CBD only at its finest. And the last thing is, this type of CBD must only be used in products that require a prescription. It cannot be sold over the counter. And we'll talk about those products and how it can be used. I just want to remind you, if you do have any questions and comments, please send those in. You can text those to 281-305-7276. And I noticed somebody put it in the chat box. So if you're looking for that number, you can definitely find that. I just want to talk about the history of cannabis a little bit. It's kind of important to understand that early on, 8,000 years ago, cannabis had been used for medical purposes back to the Egyptians. We've known it interacted with some system in our body. Obviously, back then, they had no clue what an endocannabinoid system was. And then throughout time, it's been developed. The big thing that happened here in the U.S. was in the 1930s, it basically got found out to be through a prohibition as a controlled substance. They got put to a class that's pretty much an illegal drug in the U.S. And almost all medication testing, clinical trials, understandings, and studies of the drug went away. And that's why this endocannabinoid system kind of stayed in the dark for many, many years. And so other drugs like phenobarbital and phenytoin come on the market for seizures, which was one of the big things that this phytocannabinoids in hemp has been shown to be beneficial for, kind of went by the wayside because we were studying it to look at it for pain effects, antioxidant effects, anti-inflammatory effects, and as an anticonvulsant. And then about the mid-1990s, the endocannabinoid system was pretty much understood, and we began to look at how it affected the other systems in the body. So keep that in mind. Since then, we've had an explosion of drugs in the pipeline and development to affect this system. I'll talk a little bit more about that in a minute. And then the big thing that happened for us in the U.S. is in 2018, the Farm Bill designated agricultural hemp, which is used for most of your over-the-counter products, and separated it from medical cannabis. So it made it two separate things so that basically the stigma and the negative connotation of all hemp as a whole or medical marijuana that's separated, so that we found out the agricultural hemp, which once again has less than 0.3% THC by dry weight, now can be sold over the counter without a prescription, and it is not a controlled substance. And that really cleared up a lot of things because many practitioners, doctors, pharmacists like me, we were trying to figure out how to sell it and not get ourselves in trouble with our state regulatory boards. The next slide I'm going to go over is very busy. It's got a lot of information, and I'll try to go through it, but this is the whole key to understanding the difference between what is considered a full spectrum product, a broad spectrum product, an isolate, what are phytocannabinoid isolates, and then what makes the difference between what we can compound and what we can't. So I'm gonna start at the top, and we're gonna talk about full spectrum products. Full spectrum products is the whole plant. And basically, when somebody wants to produce an over-the-counter product from agricultural hemp, they take the plant and they basically put it through a process. There are two ways to do this. One is what's called ethanol cold extraction, which basically take the plant, mix it with ethanol, and basically press out these phytocannabinoids from it. It is the truest way to deliver the phytocannabinoids from the plant. What's pretty amazing about it is that through this process, And the one things to keep in mind is that we have to look at ways to extract it and get the phytocannabinoids out and keep it as pure as possible. So a full spectrum product takes all of the phytocannabinoids, THC, CBD, and the other 40 phytocannabinoids and all the terpenes, and that's what's considered a full spectrum product. With that is something called the entourage effect, which we're taught, which means it has the full plant, and we'll talk a little bit more about that in a minute. But what's important to keep in mind, it's the full product. The other way to extract it is something called CO2 extraction. It's more of like how pharmaceutical companies process drugs. It's a lot more chemical intensive, it's a lot more high pressure stress. It's another way to extract it. So the way that I like to, though, explain a full spectrum CBD product, it's like the olive oil at the top of the shelf that costs a lot of money, but that olive oil is slowly extracted, taken from the olive plant, and you have all of the beneficial antioxidants, phytochemicals, all of the benefit is in there. We don't take anything out. It's not the last part. It's the heart of what's in that plant, and that's what's considered a full spectrum product. So as far as that goes. The next thing is something you'll hear called broad spectrum CBD. This basically means patients who, for some reason, let's say they have a job where they have been told if they test positive for THC or marijuana in any sort, they can lose their job. This is for somebody that wants to use a CBD hemp product, but does not want to take that risk, but they don't want to lose all the other benefits of the hemp plant. It's all of the phytocannabinoids and all the terpenes, except all the THC has been removed. This is an extra processing where we remove that as far as that goes. We still get a lot of the benefits of the full spectrum aspect of it, but all THC has been removed. So that way we don't have to worry about any THC. We'll talk a little bit about, some people may say, well, if you take the THC out, how does it work? We'll talk about that a little bit in a minute. But full spectrum, all the CBD, all the THC is normally produced in there. Once again, the THC part has to be less than 0.3%, all the terpenes. That's full spectrum. Broad spectrum is the whole thing too. We're going to take out all of the THC. So keep that in mind. The next is something called CBD isolate. This is CBD only, but this is derived from a hemp plant. And with this, some people sometimes feel a little more comfortable with doing this. It's just basically the stripped out CBD. Some people feel like, hey, I have less risk of having reactions. There's not as many drug interactions. I'm going to get some of the benefit of the hemp plant. We'll talk about that in a minute, but I only want the CBD. So you'll see products on the market that say CBD isolate, which means all they have is CBD. Now keep in mind, that is something that comes from a hemp plant. The thing that we're learning, and the way I like to explain that is, as far as that goes, if you look that we've got full spectrum, broad spectrum, CBD. Now, if we go one step beyond, we're getting to see a lot of products come on the market that are called isolate products. So they'll take the CBD and process it, and then they'll add extra CBG, CBN, CBV. I'll show you what some of these do. These are other phytocannabinoids that are part of the plant, part of that are part of the plant that we're learning have other chemical reactions. Like I said, the system's in the infancy. There are a lot of good quality studies that are being done right now to see what these other phytocannabinoids do. But the best way I like to explain this is, if you think of the full spectrum or the broad spectrum as like your multivitamin on the shelf. It's got your B vitamins, your A, your D, your C, your K, and your minerals. That's your full or broad spectrum. Some of these isolate products are like, okay, I want to go just take a little bit of vitamin B2, or I want to go take a little bit of vitamin E. That's what these isolate products, they're individual vitamins in a multivitamin. Once again, they're individual phytocannabinoids in a full spectrum product that may have some individual actions on their own. So that's a cannabinoid isolate. And then the last thing, which is kind of new for me, is we have pharmaceutical grade cannabidiol. It is CBD. If I take the pharmaceutical grade cannabidiol and compare it to the cannabidiol found in the hemp plant, they are identically the same. There is no difference. The difference is what I can compound with that is only available by prescription is high purity, synthetic, and is not derived from hemp. The neat thing about this is, because it is ultra pure, we do have the ability to get precise, customized doses, which are very, very important. And the other thing that's neat about this is It allows the ability for a practitioner, a medical doctor, to write a prescription for a patient that allows them to get something from the doctor in a prescription that says, my doctor wants me to have a CBD product, okay? That's very important. I have a lot of people that are a little scared to use over-the-counter hemp CBD products because, one, their doctor doesn't know about it. But the other thing I think that's important is this allows a little bit of assurance for people with their employers that say that, look, I'm not on an over-the-counter hemp CBD product. I am actually on a Cannabidiol prescription product from my doctor. I think it releases a lot of fear and anxiety because one of the things is, I will stress with you, the current THC testing, depending on where it's done, is typically a urinalysis. And these tests are not very specific sometimes. There are sometimes people actually can test positive for THC on a CBD isolate or broad spectrum product. I'm not trying to scare you. It does not happen very often, but it can happen. And I think it's super important for patients to understand. So I cannot say there is no guarantee you're going to test positive even on a broad spectrum or CBD isolate product, even if I tell you there's no THC in it, because some of these assays they use to look at the urine sometimes can cross-react with CBD or one of the other phytocannabinoids. But the neat thing about if we do a compound for that, we're actually able to give you a prescription from your doctor that shows your doctor wants you to have that. So I hope I made that pretty clear. So just kind of as a summary, I want to talk about what's important to know is what's the difference between a CBD isolate and full spectrum. So the full spectrum product, once again, contains all the cannabinoids, CBN, CBG, THC, CBD. It can contain 0.3% or less THC, so we can have a little bit or below that. It is what's called the entourage effect. And what's important about the entourage effect is that we have to look at this, that the entourage effect, the theory is like you said, it's the multivitamin effect. If we hit many different phytocannabinoids, they all have their own unique actions, will have our benefit. So that's a thing to keep in mind with what's considered the full spectrum product. And the other thing is I've read some studies, possibly a full spectrum may be better if you're using CBD potentially to help with pain. A full spectrum product may be better. The isolate product, CBD only, contains no other cannabinoids other than CBD. Its effectiveness can vary based upon dosage. One real advantage of an isolate product is if you're doing a sublingual, it can taste better. When we do full spectrum products, they typically are very earthy tasting because it has all of those phytochemicals in there. CBD by itself almost has little to no flavor. And once again, these isolate products may be preferred for somebody who basically does not want to have any THC in their system because of work or fear of losing a job, or basically, let's say they've had some history of past criminal offenses and so they can't test positive. That's where an isolate may be good. Haley's indicated I have some questions. So Haley, if you want to unmute yourself, or I'll unmute you and you can ask whatever questions you may have.
Sure, yeah. We have a couple that have come in. One of them is, why does the medical cannabidiol need a higher THC, or medical marijuana need higher THC content?
That's an excellent point. So then in the upcoming slides, that actually moves into the next slides we're going to be going into. The quick summary, and I'll talk about it more. One of the main psychoactive aspects of hemp is the THC. It's really the only thing in there that works in the brain. And it's those psychoactive components that are very beneficial to a point at higher doses of THC. The lower doses of THC, we really don't achieve high enough levels to achieve therapeutic effects with a hemp over-the-counter product. So that's the reason why the medical marijuana, we're kind of achieving a different effect with higher THC levels.
Okay, and next question. Please discuss drug interactions with CBD products. I know.
Awesome. And I have a whole slide on that, Haley, so that's a great point. Yes. So I'll make sure we get to that. If you have any further questions about specific drugs at that point, if you ask, but I have a whole slide on that. Great point.
Yes, yes. I know you'll get to that later. And then another one that we will probably cover a little bit later in the webinar, what kind of doctors are prescribing CBD products? What side of town? Is there still a stigma surrounding physicians prescribing these products?
So, and I'll touch on that one tonight. That's what makes tonight's webinar so awesome, is that we have probably as many doctors on this webinar tonight as I have actual lay public or patients, which is really awesome. Just like you as the public want to know ways to improve your health and find alternative ways that are helpful, And once again, I'm not here to cure, treat, or tell you what CBD can treat or cure. You've got to use your own education and work with your medical doctor. Many doctors are now learning and using these products in their patient and seeing benefit. And so the thing is, like I told you, none of us as medical professionals were taught this stuff in school. It's the after lifelong learning that we have to do. When patients come in and say, hey, tell me about this. I'll be honest with you, I didn't know 99% of what I'm telling you tonight 3 years ago. But it's because we have enough people coming in. I want to learn new ways to help patients that may be adjuncts to therapy. And so that's the thing that I think a lot of doctors are running into nowadays is patients are coming in and asking questions, and they're wanting to educate yourself. And we get down to the end of this, I have the ability to offer you doctors, and we can way to connect you with doctors in our area that in your area that I know are either recommending over-the-counter CBD or willing to do compounded CBD. So we'll talk about that as we move further. Haley, do you have any other questions?
No, that concludes our questions for now.
Okay, awesome. And like you said, please keep sending in your questions. That's what makes these presentations the best. So we'll move on. So let's talk about the two main cannabinoids that are found in hemp. One is THC and the other is cannabidiol. So for you science nerds out there, I put them on the screen. You can see chemically they look quite a lot similar. But the thing that's really super important to understand is those little bit of differences in the structure make a world of difference how they interact in the body and affect our receptors. And the way that I like to look at, and I heard this explained at a recent conference I was at, is that we're at the infancy with the endocannabinoid system. And the way I explain it is this. Morphine, which is a drug to treat pain, was derived from opium. And now we must have 10 to 15, 20 different pain medications that were derived from morphine, and we have more precise medicine for treating pain. Cocaine, which we all know what that is, was derived from the coca plant. But what we've learned from that is how it works. Pretty much all of your ADD medications, anything to treat attention deficit or ADHD, are all derivatives of the dopamine system, just like cocaine. So once again, right now we have CBD, okay? And we know how to chemically synthesize that. I think you're gonna see over the next 5 to 10 years that CBD is gonna have many drug companies go in and try to tweak it and change it and make it work differently to get a more enhanced effect. And once again, we're at the very infancy of this. And so over time, you're going to see new drugs come on the market. And here's the reason why. This next screen I know is kind of busy, but I want you to focus on something. This endocannabinoid system is far-reaching throughout the body, has many effects on other tissues, other organs, and other glands on the body. And what's super important is remember this. This effect on all these other organ systems to put the body back in balance, create that homeostasis, is going to drive many drug companies to try to capitalize on this. Because we're finding is through all the stress and all the different dietary issues and inflammation and overall things we all go through every day, this endocannabinoid system gets out of balance. And what we are finding is many drug companies right now are doing two things. They're either developing drugs to stimulate our own cannabinoid receptors, or they're finding ways to help our body produce its own endocannabinoids or allow those not to be broken down so fast. So that's what's going on. Because if you look at this model, the endocannabinoid system, let's look at the brain. The endocannabinoid system in the brain affects learning memory, affects anxiety, depression, controls appetite, reward, neuroprotection. It actually has an effect on the immune system of the brain, the microglial cells. It has an effect on our liver. It has a protective effect. It controls insulin resistance. Has a big effect on reproduction in terms of fertility regulation and embryonic development. Cardiovascular system. We've found a lot of information, preclinical data, and we'll talk a little bit about some of the data and studies because I don't want to sell this for something more than what it is. But a lot of effects on the cardiovascular system in terms of its effect on our vessels, our vasculature. Skeletal muscles, how our skeletal muscles and how they're formed and how they utilize energy. GI tract, I'll tell you that's one of the big things we see. There's cannabinoid receptors all throughout the gastrointestinal tract that talks to other parts of the body. And then overall in our skin, we have certain cannabinoid receptors, we'll talk a little about that in a second, that basically affect our temperature sensing and bone remodeling and some of those type things, and even have a potential effect on cancer. So as you can see, this endocannabinoid system's everywhere. It's one of the first systems that's formed in the womb when we were infants. And once again, it's been found back to primitive animals 600 million years ago. So keep in mind, it's rather extensive. So let's talk about the endocannabinoids in more detail. And this is going to kind of get into some of the stigma stuff and that kind of stuff. So we done talked a lot about THC. THC mainly binds to the CB1 receptor, and it has psychoactive effects. That's what makes recreational marijuana do what it does. People smoke marijuana, they get high, they feel good, they lose all their anxiety, they have low stress, they get the munchies. Once again, we talked about how it affects appetite and what it can do. But in a medical marijuana sense, if we get the right amount of THC, we can see benefits in terms of controlling pain, helping with nausea and vomiting, controlling seizures. It actually can be used for weight loss, and it actually can be used to treat glaucoma. Here's what's crazy about that CB1 receptor. Like I told you, it's not a true on-off. It's what's called a G protein receptor. What does that mean? G protein receptors have the ability to be understimulated, right stimulated, and overstimulated. When we overstimulate, sometimes you'll see people who will smoke a recreational marijuana that's very high in THC. We'll actually see it go the other way. They'll have extreme anxiety, massive agitation, horrible paranoia, to the point they'll get admitted to the emergency room because they have an overdose of THC. So once again, that's THC. That's one of the phytocannabinoids that's in hemp. So that's that aspect. Cannabidiol is really unique because the more we learn about cannabidiol really doesn't have an effect on that CB1, CB2 receptor at all. What we are finding out what it does is CBD actually works. Remember we talked about anandamide and 2-AG? Well, what's really unique is that body has the CBD has the ability to keep or help the body not break down anandamide so fast. So we make our own endocannabinoids. They stay viable. They stay active longer because CBD prevents the breakdown. The other thing it does is it actually helps the body in the production aspect of making our own endocannabinoids. So that's the reason why we can do a CBD only product, no THC, and get some clinical medical benefit, is because it doesn't even really bind to our receptors, but it makes our own endocannabinoids work better, stay in our body, not be broke down so fast. So it's super important to keep that in mind. That's how some people are like, well, how can we even get any benefit if we take all the THC out? Once again, it's a different effect, but CBD on its own has clinical benefit in the body. Many others we'll talk about, but when it comes to that CB1, CB2 receptor, it really, if it binds that, it binds it at best very minimally, but it really makes our own endocannabinoids work better. The other thing there's some talk is it's the yin and yang. That plant is made with THC, it's made with CBD. It's the balance of these two. So if we get too much THC, if we give a lot of CBD, sometimes we can balance it out. There's some thoughts or there's some theory is if somebody overdoses on THC, you can give them CBD to calm that or balance that out. Here's the other things we're learning though that's unique to CBD. It has the ability to possibly have a detox effect on the liver. It does have a liver effect in terms of our enzymes. We'll talk about drug interactions in a minute. That's a great question because that is something we have to talk about. That's why we really don't want to be doing any over-the-counter hemp products or CBD products without talking to a medical professional. But what's important is it can affect the liver in a positive way. And also, like we talked about, there are cannabidiol, CBD effects in the brain to affect the immune system and reduce inflammation. The next thing is it actually is a balancer of the CB1, CB2 system in terms of helping the own body's natural endocannabinoid system work. This next thing is to me what makes CBD unique. There are other endocannabinoid systems or receptors other than CB1 and CB2. There's something called GPR55. That one is really unique. There's a lot of really great research going on in terms of cancer development and research that may actually have the ability on some cancer. But the other unique thing about that is the receptors that the body uses in terms of your ability to keep your bones healthy. So that's one of the ways. There's some theory and there's some preclinical data that says possibly CBD, hemp products may be beneficial in keeping your bones healthy as you age. I think that's real important to keep in mind. The next you'll see is this TRPV1. It's a vanilloid receptor that's in the periphery. It's all over our skin. It's in other places, but it modulates pain. It has a thermosensory regulation. That same receptor, I don't know if you've ever heard of capsaicin or what the juice that makes hot pepper hot that we've used for years to help with pain. That's the same receptor that CBD hits or cannabidiol that capsaicin affects, so they can be used topically for burning and pain. I think that's really super important to keep that in mind. The other thing that's really unique about CBD, CBD is an antioxidant. CBD at the skin scavenges up reactive oxygen species, just like a polyphenol. Remember I told you about olive oil and all these polyphenols in olive oil? Just like olive oil, CBD is an antioxidant that's found in your hemp plant. So keep that in mind. It has the ability to reduce oxidative stress in the body. And the last thing it is, it's really unique. It has the ability to upregulate and downregulate and control our neurotransmitters, especially things like serotonin, which is our mood transmitter. And it also has the ability to affect GABA. When we think of stress and anxiety, we think of our typical anxiety drugs like Valium, Xanax. Those drugs work on the GABA system. They try to help stimulate GABA, which is an inhibitory transmitter. CBD has effects to work with that GABA system, and that's some of the theory why CBD may have the ability to work to control stress and anxiety. So I hope, like you said, hopefully that gives you a better understanding of why THC is important. Once again, we may have higher THC in some products to get some of these more clinical effects, especially in the brain in terms of controlling nausea and seizures and pain. But we don't necessarily need high amounts to get clinical benefit because CBD and all the other phytocannabinoids in there also have a medical benefit. Just want to show you, this is just a portion of some of the phytocannabinoids in CBD. As you can see, CBD is the most studied. It's got the most studies and clinical data to show it may help in these things. So you can see that big, long list of things that are available there. But we also have many other things. Like one of the ones that's gotten a lot of attention lately is CBG. There's a lot of thoughts about CBG and its effect in the brain to control inflammation. And I think you're going to see, like I said, development of drugs around similar chemicals to these that work in the body on this endocannabinoid system, but produce a clinical benefit for some type of a medical outcome. But I just want you to understand all of these work together on the endocannabinoid system. CB1 receptor, CB2 receptor, the vanilloid receptors, that GRP55. And we're actually finding more and more. I saw something the other day. There may be up to 10 to 20 different endocannabinoid receptors in the body. We are still learning. Keep that in mind. But I can tell you today, after today's talk, you'll know more than about 99.9% of the people that even research this stuff, because this really is the latest data, and you need to know, a lot of the truths. That's the goal for tonight, is really get a lot of good science that we know so you can make a good decision about your health. Here's what's important, and I can't stress enough. I don't want to oversell CBD for anything. I will tell you, current literature indicates that CBD may help certain conditions. Most of the conditions that are listed here are what are called observational studies. We took 25 patients and we gave them CBD, we gave them hemp, and we monitored them. Or we took monkeys, or we took mice, or we took human tissue, and we did these studies or experiments, and we found this. At this point, I hate to say it, there's not a lot of big double-blind placebo-controlled trials. I think at this point, because of what's going on nowadays with the COVID-19 and all the different drugs that are being used, people have gotten a lot more educated about studies. And I would totally agree. We want to basically make sure we do what's right, make good clinical benefits. And as a medical professional, I have always been and taken the motto, do no harm. We know CBD, once again, has been used medically for many, many years. I think if it's done right, done with the working of a medical professional, I think your risk is very minimal. I can't tell you it's going to help with anything. So keep in mind, indications of literature show CBD may be helpful for, and I want to stress this, and I want to kind of highlight some of the big ones. This is a big, long list. So here's the things I want to talk about. Let's back up. Big things that I want to stress that we see in our practice. Acne is a big one. Depression is another item. The next big things for that is going to be PTSD, schizophrenia, sleep disorders, stress and anxiety, and pain. I saw something come up in chat about Crohn's and colitis. I can tell you that we have seen really good benefit in our patients. Once again, I'm going to call this is observational. I don't have a study. I haven't tested it against a placebo. I'm going to tell you observational. When we've given patients high quality CBD products with chronic gastritis, Crohn's, we have seen a minimization or help improvement of symptoms. I have a pharmacist that worked for me that's had GI symptoms for many years, that's dealt with past colorectal cancer, things like that. We've done some other drugs that's given some benefit. When we added CBD, it had a dramatic benefit in what he's able to eat and what he's not able to eat, where in the past there were certain foods that if he ate, He got intense diarrhea, bloating, gas, and could not function. CBD has allowed him a little more leeway. Once again, I'm not trying to oversell it for what it is, but I do want to stress there's a lot of information that CBD can have a real big benefit, or hemp products in terms of gastrointestinal disorders. But I just wanted to highlight the big ones. When we have people come in and ask about CBD, one of the things that I think we get the most questions about is use in terms of sleep, pain, anxiety, stress, topical rashes, and topical pain. There's a lot of other things, as you can see on this chart, that it may be helpful for. So I just want you to be aware of that. And obviously nowadays you can go Google and find something on anything. You do want to try to find reputable sources of information and just don't go anywhere. So the next screen I'm going to talk about, we've kind of talked about a lot. I've kind of beat a dead horse, but I just want you to understand that you know what's going on. CBD, industrial hemp, non-psychoactive. It can have up to 0.3% THC. It does not have enough THC to give you a euphoria, make you high. It doesn't make you intoxicated. It's legal now in almost every state but a couple, I think, because of the 2018 Farm Bill. So that's CBD industrial hemp. Medical marijuana is associated, can give you the feeling of being high, because once again, high THC works on that CB1 receptor in the brain, can be psychoactive, results in euphoria, can have 5 to 10% THC. And once again, medical marijuana is still illegal in a lot of states. It's legal in some states with a lot of regulations, but that's what makes those two things different in terms of CBD and medical cannabis. Haley, I'm going to unmute you for a second just to ask. I've answered a few questions that are out there in terms of things I've seen in chat. Do you have any other questions?
Yes. What is the average cost of CBD products, both prescription and over the counter?
Good question. And we'll kind of talk a little bit more about what's the difference in the two. But right now, it's all about quality. I'll talk about that in a minute. But a high quality CBD product that's tested and pure is going to run most patients anywhere between, probably at the low end, $40 a month up to $90 a month. When we compound with it, really it's about in the same price range. What we have seen with compounding is we will take some compounds that we use. I'll use an example, something like low-dose naltrexone. We've combined CBD with it, and it basically can keep a person from having to buy two products. We put it in one, and it can reduce costs that way. So once again, most patients, anywhere between $40 to $90 a month. I know there's lots of CBD and hemp products you can get out there cheaper than that. We'll talk a little bit about how to go shop for those, but that hopefully will kind of help give you an idea of general cost you're looking at. Any other questions?
That's our only question. You can move on now.
Awesome. Great. Thank you. Let's start talking about products. And I think this is where the rubber meets the road. So take all the science you've learned and now let's put it into practice. How can it help your patients, or how can it help yourself in terms of medical conditions you may be dealing with? So the first way that we do a lot of commercially available over-the-counter products and even compounds is doing tinctures or sublinguals. These are either liquids that are in a dropper or little dissolvable troches that you put in your mouth. So once again, there's over-the-counter versions of this. We have compounded versions of this. They get absorbed through the skin in the mouth, and that has a real benefit in terms you get very rapid, quick results. Within 10 to 15 minutes, lots of times, you'll see the benefit of the hemp, CBD, THC, whatever little bits in there, get in the body and begin to work. What's really kind of nice with a lot of these products, it's easy to adjust the dose. A lot of these have droppers. You can control the number of drops you put in. Our troches, you can break and start out with a quarter and go to a half, so you can easily adjust the dosage. We have some of these products that are designed with a smaller particle size to get absorbed a little faster. I think that's important to keep in mind. And the point is, there are multiple forms that you either can do a liquid or troches to get this in the system. Once again, fast relief, gets in the system quickly. It gets cleared out of the system quickly. So when I think of troches and tinctures, I think of quick acting things like we need, maybe like stress and anxiety, and maybe for sleep. We want it to get in the system fast. We want it to work quick. We want to see if it gets benefit. So that's going to be tinctures, once again, which mostly are going to be over-the-counter sold products. There are a lot of, and we can also do some liquids. The other thing are items that are things we can compound to put the cannabidiol in a troche that you can dissolve in the mouth. I got a chat I was reading. Hold on. So what's really unique, I got a question about the research that's done. Most of the research done nowadays is done on CBD only or THC only. Once again, a lot of it's preclinical. It's done either in typically in animals or it's observational studies. Most of the data is not about full spectrum. You can find some full spectrum observational stuff out there. And that's where, like you said, where I think, like you said, with the chat, I hope I'm answering the question is as far as that goes. There are many different types and quality of CBD over-the-counter products. I want to stress. That's why I want to talk a little bit about what to look for. So once again, I don't want to be real careful about claims you see on the internet. I'm trying to tell you science tonight. These are things that may be helpful for. But most of your actual true studies that are science-based and some of your, what we're going to call PubMed journals, clinical journals, are CBD only or THC only studies. Most of it is not done with full spectrum hemp. We're going to assume or extrapolate when we get full spectrum, we should see all that plus more because of what's called the entourage effect, but you really can't do that. That's why you've got to use a quality product and kind of figure from there. But that's a great question. I'm glad that got brought up. So the next product we're going to talk about is going to be oral capsules. So what's really unique about CBD, especially cannabidiol, is fatty in nature. So what we have found is if we want to try to take CBD or even hemp and take it as a capsule that goes in our mouth to our gastrointestinal tract, what we have found is that if you just take the pure powder, it really doesn't get absorbed very well. So most of your over-the-counter products are oil-filled capsules because we found if we put the CBD or cannabidiol in oil, we get a better absorption. So keep this in mind though, unlike the ones that go through our mouth and go directly into our circulation through our mouth skin, when we take something by mouth, it goes from our mouth down our esophagus into our stomach. When things leave our stomach, it has to go to our liver, which our liver does some things to it, and then it goes out to the circulation. So there's what's called a first pass effect. Because of that, we see a little different effect with some of the molecules. And because of that, unlike the oral sublingual tinctures or troches that take 15 minutes to 30 minutes to work, it may take up to 90 minutes to an hour and 20 to see the full benefit of the product. Now, the benefit to that is because it takes a while for the CBD or the cannabidiol or hemp product to go through the gastrointestinal tract, we get a more prolonged effect. So maybe if you're treating pain and you don't want to be stuck taking something 2 or 3 times a day, you may see benefit in doing a capsule form of CBD, hemp, cannabidiol. When we think of taking something by mouth, we think about getting an all over a body effect. It's going to go into our stomach, it gets absorbed and goes all throughout the body. So we're going to see a lot of benefit and throughout the body as far as that goes. So I want to stress that as far as that goes. And the next thing as far as that goes that I want to talk about is it's really important to look at, you can avoid some of the taste issues. I do have some patients that don't like doing sublingual, especially full spectrum products. They tend to be very, like I said, earthy. When we do capsules, you don't have to worry about taste. You don't get it in your mouth at all. But what's important to keep in mind is if you swallow the capsule, we avoid that. I have found, though, the sublingual products of CBD only, we don't have a taste issue or cannabidiol. It's the full spectrum that typically are more of a bigger issue. If you do take an oral capsule, whether it be compounded or whether it be over the counter, there is no problem at all with taking it with a high fatty meal. That'll help get it absorbed. Or if you take other supplements over the counter that are fatty in nature, fish oil, vitamin D, vitamin E filled capsules, take those oil filled capsules with your CBD or hemp, you may get a more higher clinical benefit. And the other thing that we have learned is that chronic dosing of high dose CBD, this is important, typically we'll get high therapeutic levels. It takes a little while to get there. That's why we got to be careful with not going up on the dose too fast. But if you're on CBD for 15, 20, 30 days, high dose, it will begin to build up and get higher levels in the system. And that's important to keep in mind. One other advantage of the oral route that I like to talk about is the effect that it has in terms of it bathes the gastrointestinal tract with this hemp, CBD, all the phytocannabinoids. And there are some thoughts that we may get an extra gut protection benefit, or if you have gut issues, you may have a more better benefit by doing a capsule versus a sublingual or a troche as far as that goes. I'm getting a lot of questions on chat, and to make sure I kind of flow through it all, I promise I'll go back and answer those, but I just want to let you know I do see those that are there, but I want to kind of keep it going so we have enough time, but I will make a point to make sure we go through all those. Next options are transdermals or topicals. I want to state what the difference is. One of the things I mentioned is CBD has tremendous antioxidant effects on the skin, which means it It has a way to scavenge up a lot of the irritative things that can go on with the skin. And the other thing that it does, it binds to some of the receptors that are endocannabinoid receptors on the skin that can control sebum production, that's the oil in the skin, and reduce inflammation. So if we want to use a product like a lotion or cream for a local effect on the skin, whether it be things like eczema, psoriasis, or rosacea, that's a local irritating effect, or even inflammatory things, even maybe like a shingles rash or muscle pain, we want to stick with something that's on the skin level. We'll use a lotion or a cream. Both of these are available as a compound. We've done some of these as compounds. We have a really nice lotion that's great for rashes. So that's something we're trying to keep it at the skin level. As compounders, we have the ability to compound something unique that's not available over the counter. Okay, let's say you don't want to do a sublingual tincture, or let's say you don't want to swallow a capsule. We have the ability to put CBD, cannabidiol, into a super strong penetrating transdermal that will drive the CBD through the skin into your circulation so you can get a total body effect. So instead of treating something local like a muscle ache and pain, you actually have the ability to get the CBD all throughout the body to help treat things possibly like nausea or anxiety. And it really works very, very well. So keep that in mind in terms of what's available. There are creams and lotions for a more local skin effect. And then there are transdermals that we can compound to drive it through the skin to get an overall body effect. The next two are strictly compound. I want to kind of talk about this. I know our practitioners are very well of the over-the-counter products, but you may not have to know we have the ability to do a nasal spray of cannabidiol. There's some thoughts. This is a very rapid onset. There's some studies to show we get about anywhere between 30 to 40% absorption. One of the highest ways to get absorption with cannabidiol through a nasal spray. There's some thoughts we may get higher levels in the central nervous system because when we deliver things to our nasal passages, it has the ability to get to our brain a little faster and at higher levels. So I want to stress that if we use a compounded nasal spray, that may be something unique. Once again, that is compound only. You'd have to go to a doctor to get that. So practitioners will talk a little more about how to get more information on that. Patients, you'd have to see a doctor. And then the other thing we've been doing a lot of compounded is we've been doing a lot of compounded rectal vaginal. We have a lot of patients with chronic rectal vaginal pain. They've had, whether they've had babies, they've had colorectal cancer, they've had procedures where they've had colorectal surgery, and they have structural changes where they've cut into nerves and had to rebuild tissues. Or a patient, unfortunately, due to different medical conditions, have chronic pelvic floor pain. We've had really good success in terms of these patients. Once again, I'm not trying to treat or make any indications, but once we talked about those receptors at the body that are on the skin level that have this endocannabinoid system that tries to put things back in homeostasis or back in balance, we've done a lot of topicals. We've had good success with with rectal and vaginal application. These are prescription only, cannabidiol only products, but it's something else, another way to do delivery. So I just want to make you aware of that. The last thing I want to talk about or kind of going into before we go into some other questions is, if we're using CBD, whether it be full spectrum, isolate, or over-the-counter product, or our compound, it is very important if we're using something that gets in our system. CBD has the ability to lower blood pressure. If you're on blood pressure medicine specifically, we want to monitor blood pressure. That's very important. The other thing is just normal side effects, not overdosing side effects, can be mild dry mouth, drowsiness, and some gut issues. Ways to know you've taken too much CBD or cannabidiol: headache, fatigue, tiredness, excessive somnolence, you feel tired, diarrhea, and basically decreased cognitive function. You just feel like you're just mentally exhausted. You don't want to push. You don't want to kind of do anything. So those are some things I want you, like I told you, this is a medication. It works in the body. It's not 100% pure. It's not 100% clean. You need to know what to watch for common side effects, but you also need to watch for if you overdose and do too much. I realize there are people out there that do this stuff on their own, or maybe buy an over-the-counter product that doesn't say what it has on the label, and they take it and they have these excessive side effects. That may be an indication that you're getting too much of the product. So I think that's important to understand. Next, we're going to talk about drug interactions. This is very important, and this is why sometimes I have a little bit of anxiety myself about this overall rapid sale of these hemp isolate or CBD products over the counter with really no medical supervision. Many obviously of my patients are on drugs. There's many are take medications for certain medical conditions. I shouldn't say use drugs. That didn't sound good. But one of the things is CBD has the ability to work on the liver and control how your body breaks things down. Once again, it actually has a beneficial effect. There's actually some studies helping. It can help somebody who has a very poor functioning liver. But in the same process, how the drugs broke down, it has the ability to affect how the metabolism of other medications you may take. Some of the big ones are blood pressure medications. Medications used to treat anxiety and stress, what are called SSRIs, things like fluoxetine, Paxil. Those are things that can be greatly affected by CBD. The other thing to keep in mind, there are some antihistamines or certain drugs we take that are antipsychotics, things that control our immune system. So I can't stress enough, if you're going to take a CBD product, prescription or over the counter, you need to consult with a pharmacist or your medical practitioner and say, are the drugs I'm taking, what do we need to do? Blood thinners. There are a couple of blood thinners that are very important you cannot take with CBD, or if you do, you have to be very cautious. There are several seizure medications. So I can't stress this enough. This has its drug interactions. It needs to be monitored, and you need to be super safe. The blood pressure medicines definitely are some other things to keep in mind, so I want to stress that. So here are a couple other CBD considerations I want to stress. If you're going to take pain medications, I will tell you two of the big things that we have seen is that CBD in some patients, full spectrum, isolate, and even the compound can be used to reduce the amount of narcotic pain medications people need. Once again, you don't want to do this on your own. You want to do it with a medical practitioner. But if we have the ability to reduce the amount of opioids somebody takes, we all know the opioid crisis our country is in right now. I think it's a good alternative. It's something that needs to be discussed with a medical doctor. The other thing is people take a lot of drugs like benzodiazepines, things that affect our anxiety and mood. CBD has the ability in some patients to basically help reduce the amount of looking at what can be done and what can't be done. So what's important to keep in mind is I don't want to tell you tomorrow, hey, stop your pain medicine, stop your benzodiazepine for anxiety, but you may be able to work with your doctor, and what we may be able to do is reduce those doses. I've read some studies that says if you're going to take CBD products, cannabidiol products with pain medications, you maybe want to take them at a different time of the day. The other thing we've seen with some of our compounded topical products is the CBD may oxidize in those topical products. They may discolor a little bit. It doesn't affect the quality of the product, but they may change color a little bit over time. So I want to stress that with you in case you get a cream. I'm of the fact to tell you CBD, hemp, cannabidiol is one piece of the wellness puzzle. There are many other things you have to look at in terms of your diet, stress, hormones, sleep. Do you have any environmental toxins? There are so many other things we have to look at. CBD, hemp, cannabidiol is one piece of the puzzle. But what are some other things that have been shown to work to make our endocannabinoid system work better, or to get the most out of the CBD product you're taking? One is take vitamin D with it. It works to reduce inflammation. So you want to make sure if you're taking CBD isolate, make sure you have optimal vitamin D levels. Other things, especially if you're taking something for inflammation and pain, make sure you're taking a good high quality fish oil. Make sure that you're taking magnesium. Make sure you're taking a good quality curcumin and a probiotic. All of these things may reduce inflammation in conjunction with your CBD. Had a lot of questions about, we get this all the time. Hey, I bought this CBD product over the counter. I ordered it off the internet. And my ears just go up when that happens because I can't stress enough. I've done explain to you tonight, these are powerful substances. You need to know what you're taking. You don't want to go buy the cheapest. You don't want to go buy something that's not regulated. And unfortunately, this is a very unregulated industry. I like what's being done in a lot of states to basically put some, I want to call bumpers. If you're talking about bowling, to put some bumpers on here. So make sure we don't get outside the bounds. Because unfortunately, I've seen patients come in with products that, in my opinion, have little to no CBD. I've seen people come in, they'll take a product that's supposed to be over-the-counter sold that's got excessive amounts of THC. They get high off of it. And that really scares me. So I cannot stress enough, if you ever buy any product, we have quality products here. More than glad to sell that to you. I'm not here to sell you anything tonight. But what I think is super important is that you need to make sure that you buy a product that's got a certificate of analysis. I know here in Texas, there's a new law that just went into effect. As I buy products in the future, I have to buy products that allow you to get a certificate of analysis. And so I cannot stress enough, if you're getting any CBD product, if they can't give that to you, do not buy it. What is a certificate of analysis? This is a document, and hopefully the CBD company where you got your CBD from produces and has third-party tested to show how much THC is in it, how much CBD in it. And if they do a really good job, they'll even show you some of the other phytocannabinoids and the terpenes and the levels that's in that particular bottle that you have. Now, you also need to look for, remember I told you, they have to get these chemicals from the hemp plant. They use chemicals to pull that out. That's why I like ethanol extraction with alcohol, very safe. But a lot of these companies use high-powered solvents and pressure. They should also test a product to look for solvents. The hemp plant is really unique. I told you what makes hemp unique is how it's grown. It's what makes the THC content in this plant different from this one. The hemp plant pulls a lot from the soil. So you need to find a CBD product that's tested for pesticides, herbicides, heavy metals. They should be testing that. All of that should be on a C of A. We need to be looking at that. If you get a CBD product and cannot get that, do not take it. I cannot stress enough. This industry is not regulated to the point right now. There's a lot of people trying to get in the game. There's a lot of people selling low quality products to try to sell you something. I don't want to see you buy something that's not quality and you say, oh, I took CBD and it doesn't work. But if you don't know the quality, you don't know what you took. That's what makes compounding unique. On this cannabidiol I get, that's pharmaceutical grade, ultra pure. I have a very high-end CBD showing me exactly how much cannabidiol is, showing me it's ultra pure and how it has relatively no THC in it. So I cannot stress enough, it's super important. If you're going to get an over-the-counter product, you need to know what you're taking. If you're going to get a compound, we have the ability to be ultra precise with dosing. That's what makes the compounding unique. But I cannot stress enough, make sure you get a quality CBD product if you're going to take it over the counter. We're going to keep flying through these. Other things you can do in life, make sure you eat an anti-inflammatory diet to control inflammation. If we have a lot of inflammation, eat poor diet, we deplete our own endocannabinoids. Optimize your vitamins and supplements, optimize your thyroid and hormone levels, make sure your gut is healed. That's super important. And then you also want to control stress and sleep. So lastly, I think Haley has some questions. While Haley's reading questions, I'm going to try to read the ones in chat. I've got a little bit of wrap up at the end. I want to talk to you about how you can learn more, how you as practitioners, if you want additional information, where you can go get that, how patients tonight, if you want to be hooked up with a doctor that does CBD, I can help you with that. And so we'll talk about that in a minute, but I kind of want to make sure I get all of your questions answered tonight. We don't have a hard stop at 7:30, but I want to make sure that we get everything that you get answered tonight to make sure that you understand. So Haley, I'm going to let you ask questions and I'm going to try to read through the chat to make sure I get those when you're done too.
I only have one in my other text screen, so I'll go ahead and read from the chat. I have those organized already, but has there been any specific research regarding the use of CBD to treat Crohn's and colitis?
So those are good. So there are some very good preclinical data. Once again, data done on animals, but then also if you look at things like some observational studies, I've seen some really good stuff for GI, Crohn's, colitis, irritable bowel. So those are definitely things to consider. People have maybe chronic gastritis, that CBD may be helpful for that. Yes.
Okay, and next question is,
And Haley, I see the next one you're reading. Once again, most studies are done CBD are THC only, clinical research. Once again, a lot of these preclinical studies. And so once again, can you say the same thing about hemp cannabidiol? You can, because we know the hemp product has CBD, it has THC. The thing like we don't know is exactly how much of those are in there. And so that's the only tricky thing about it. There's no standardization what one product to another means. And that's why I've talked about the quality. You got to make sure you're getting what you're wanting. Once again, THC, when I say it, it has two functions. One part of THC, you're right, there is the medical marijuana aspect of it that basically is regulated. It's grown to be a certain percentage. There's definitely medical data to show that it has good quality uses. I am not here to knock that. I have seen some patients that have turned to that with tremendous benefit as far as that goes. Unfortunately, here in Texas, we don't have the ability to produce recreational marijuana. We don't have dispensaries like other states have. So unfortunately, it does get a bad moniker because once again, everything's done on that side under the table. Unfortunately, with the way our Texas laws are, it is a little hard to get medical cannabis. We make people jump through a lot of hoops to get it, which is kind of sad. Once again, I don't have any control of that. I'll tell you, I'm very advocacy worthy nowadays. The only way to change that is get involved, talk to your legislators on a federal and national level if you have somebody in your family that would benefit from it, because that's the only way we're going to get things changed or done. So once again, I don't want to give recreational marijuana a bad stigma. It is unregulated. It is under the table. In Texas, it's against the law, unfortunately, or fortunately. And so that's just what we deal with. And I think hopefully that answers the question about hemp and the marketing and that. And it is very confusing. So hopefully tonight I've set apart what hemp OTC is, medicinal marijuana, CBD isolate products that we can compound with, and those three differences and what makes them all unique as far as that goes.
Steve, what about CBD for rebound, reflux, and the use of PPIs? You mentioned earlier CBD and LDN. Do the two medications work well together?
Yeah, so that could be one whole lecture talk. I've done it before on LDN and CBD. We probably will have a webinar coming soon on LDN. I would tell you that is probably one of the biggest bang for the bucks we've seen. The endocannabinoid system, which is what CBD works on, plays very much hand in hand with the endorphin system or our innate opioid system. They work synergistically. We have a lot of patients who do low dose naltrexone, LDN conjunctively for gastrointestinal uses. So I would definitely say we have seen patients with benefit. Once again, observational. I don't have a double-blind placebo-controlled study to tell you that's what it did, but I can tell you it may be something to consider to use. We see a lot of benefit on the GI side with LDN, low-dose naltrexone, but the CBD could be added to it. In terms of rebound and reflux, I don't off the top of my head know a lot about it. I would say most reflux and stuff is typically due to either low or high acid levels. Sometimes certain foods affect that esophageal sphincter in terms of the tone. A lot of times inflammation can drive that. As we know, CBD can help reduce inflammation. So that may be something to consider. I think it's something that you might want to consider using that may have some benefit.
Okay, next question. Is hemp CBD really as potent as the whole cannabis plant and CBD?
Is CBD only this as the cannabis, like the phytocannabinoid, the whole plant
Yes.
versus CBD?
Yeah.
Okay, great.
Does hemp CBD really as potent as the whole plant CBD? I guess meaning without the removed THC?
Yeah, so that's a great point. So hopefully, and I'll try to reiterate that really quick. Think of the think of a full spectrum product that's got everything. A little bit of THC, all the other phytocannabinoids, all the other terpenes. That has the entourage effect. That affects the body in multiple different ways. All of those phytocannabinoids and terpenes have their own unique individual place, what they do in the body. And that's what's called the entourage effect. And like you said, there are some theory in terms of pain that may be a better route to go. Like we talked about, CBD, if you just pull out CBD by itself, CBD has a therapeutic effect in the body by allowing our own endocannabinoid system to work better. It prevents our own endocannabinoids from breaking down, and it affects other endocannabinoid receptors in the body. It has antioxidant effects. So once again, when you take the full spectrum, you get some CBD. When you take CBD only, you only get CBD. CBD by itself does have therapeutic beneficial benefits, but I cannot stress enough that that's where some people are just like, I don't want a full spectrum. I'm afraid of the THC. I only want either what we call broad spectrum, no THC, or I want CBD only. That's what makes the ultra purified pharmaceutical grade CBD that we can compound nice, because we have the ability to precisely dose that for the exact milligram your doctor feels is necessary to treat whatever conditions needed. And so I just want to stress that that's where the compounded CBD may offer benefit. But CBD by itself does have a medicinal benefit. It's not the same as full spectrum, but it can be beneficial in treating medical conditions.
Okay, last question is actually related to testing and levels. Is there a way to test levels, urine, blood? What is considered therapeutic?
So that is an awesome question. So right now, we really can't. I think there's some studies that are done looking at therapeutic levels in animals when they do some of the preclinical data. Like I've told you before, I think over time, we are going to have the ability, and I think it's at its infancy, to check our own endocannabinoid levels, to know where our own levels are, to know, do we need to supplement with something like CBD? Do we need to do something? And then I think over time, you're going to see, I mean, right now we have the ability to look for THC in urinalysis, but I think over time, we're going to have the ability to check things like THC or CBD within the blood and check levels, because we are looking for a therapeutic value. I think that day is coming. Once again, we're still early on in this. We're, like you said, at its infancy, but I think at this point, the day is coming, but that day is not here yet.
I had a few more questions come through as I refreshed on my other side. I guess one of the question is, I don't understand how if the pure pharmaceutical is not actually a hemp product, if it's called pure, if it's a pure product.
Yeah, so that's a great question. So here's the way I'll explain that. We get asked this about some of the hormones we compound all the time too. So there is a substance called limonene. It's chemically very similar to, actually it's a terpene that's actually made in the hemp plant, but it also can be produced. Limonene is chemically transformed into CBD. Then you ask, well, how do you know that? If you take the CBD out of a hemp plant and you take the CBD out of what the purified pharmaceutical that we can purchase is and look at them under a microscope, they are identically the same structure. So that tells me if I give you the hemp-derived CBD or the pharmaceutical-derived CBD, we're going to get the same therapeutic effect. They're not similar in structure. They are the exact same structure. The way I explain this is we do some hormone replacement at our pharmacy. And believe it or not, some of the hormones that we produce are actually made from yams, okay? And the way I explain that is they take a yam, put it in a lab, chemically alter it, and produce, for instance, progesterone. What's really amazing is, even though it started out as a yam, if I take the progesterone that's in your body as a female produces, and I take the progesterone that we compound with and put it underneath the microscope, it's the exact same chemical structure. It's not like progesterone. It is progesterone. So the exact same thing is true for this CBD, the pure cannabidiol that we can purchase. Granted, yes, it's chemically made in the lab, but it's the exact same chemical structure that the cannabis sativa plant produces. Hope that answers your question.
Okay, Steve, next question. Have you heard of any benefits of CBD for restless leg syndrome?
It seems like I remember reading an article that it may be helpful. There's a lot of things that I could tell you about restless leg that you want to have checked that are outside the norm, from things like iron levels, magnesium levels, and different things. So with that said, is it something it potentially could provide some benefit? But once again, I'd have to do some research. I don't know for sure on that as far as that goes, but that's a really good question.
Okay, it's refreshing right now. I'm going to see if I have any last questions or comments come in, but.
Sure. So Haley, I'll go to the next slide while you're looking and we'll just talk. If you are a patient tonight on this webinar, I want to make available to you, if you have any questions or you're interested in purchasing a high quality tested CBD product, you're more than welcome to call our pharmacy. The number is down below. I have myself and 5 other pharmacists here that are very well trained that can answer any questions and help you pick the right over-the-counter CBD product for you. Numbers there on the screen, 281-356-9089. If you have specific CBD questions after tonight, medical related, clinical related, please don't hesitate at all to email me. My email is there. I'm more than glad to answer any questions that I have. So kind of keep that in mind. More than glad to do that as far as that goes. The other thing is that if you are a medical practitioner tonight and I got you interested, you didn't know you could actually write a prescription for compounded cannabidiol. That way you kind of give that extra protection or that extra to yourself in terms of recommending a CBD product, but maybe you have an alternative you hadn't thought in helping with your patient. You can email Haley at the email below, the Haley C at Magnolia, and she will get in contact with your office to get you information or set up an additional Zoom call or something with your office so that we can do some further education to make sure that you have the right product and the right information so that you can help your patients in terms of that going. So I just want to make sure you have that. Once again, we do sell high quality CBD products here. If your purchase is over $50, we do offer free complimentary shipping. More than glad to do that. We can do that all over the phone. More than glad to help you. So if you are interested in the future, please feel free to give us a call or email either one of us, whether you're a patient or a practitioner. if you're a patient tonight, you're like, hey, I want compounded CBD, I have a list of all the attendees tonight, and I will be more than glad to put you in touch with a practitioner that attended our webinar or that already compounds CBD. If you'll just email me your name, where you live at, I am more than glad to share that information with you. My goal is to hook up like-minded people that want to learn and improve their health, and that's what the whole goal of our webinar is tonight as far as that goes. I did get one last question that says, are your products made with isolates or powders? All of the products that we sell over the counter are all made from hemp. They're all hemp derived. We have full spectrum, we have broad spectrum, and I do have isolates. All of those come from a hemp plant. They are hemp derived. The things we compound in our compound lab are made from pure isolate powder that is chemically made in a lab that is exactly the same as CBD, but is not hemp derived. We cannot compound with hemp derived products. It is against the law. It should not be done, but we do have the ability to compound. That is an isolate product derived in a lab. All our over-the-counter products are all derived from hemp, the Cannabis Sativa plant. The next thing I want to say is we've had a lot of great people attend tonight. Attendance has been phenomenal, so thank you very much. I will tell you, if you like what you see tonight, we're going to try to post this on our Facebook page. Please share it with your friends and family. We would love for them to watch it. I hope they enjoy it. We're also going to put this on our YouTube page. We have a Magnolia Pharmacy YouTube page. But one of our quality companies, to me, sets the bar for excellence in quality, over-the-counter, full-spectrum products is Imbue Botanicals. And I mentioned certificate of analysis. Every single one of their products has a certificate of analysis on there with a QR code. You just take a picture and you'll get more information than you ever wanted to know. They were very gracious and donated t-shirts and full-spectrum products that after the end of tonight's webinar, I'm going to print off a list of the people participated. I'm going to do a random drawing, and I'll email you. You will receive a $300 gift basket of Imbue products. So thank you so much, Imbue, for what you do. If you're interested in CBD products, if you call our pharmacy, don't be surprised if we recommend their product. It sets the industry standard in terms of the excellent. But one of our attendees tonight that attended the webinar will receive a $300 Imbue Botanical basket. So glad you could join us. And so that's something there. So at this point, that's the end of my slides. Want to make sure that we've answered all your questions. And Haley, do you have anything else by chance that you would like to have questions on or like to discuss at this time?
Somebody asked about your low-dose naltrexone and cannabidiol presentation, where that is accessible.
Awesome. How about email me? I'm more than glad to share that. And Haley and I can tease tonight. We have Miss Low-Dose Naltrexone herself coming in October to do the release of the new LDN book. She's going to do a presentation of her story. We're going to talk a little bit about low-dose naltrexone. So if you were on tonight's list email and got offered this, keep an eye out for that. That'll be coming soon. We'll have a registration. We're going to do some autographed books with Linda Elsegood from the LDN Research Trust. So that's coming soon. But if you want information about my presentation, you can email me and I'll be more than glad to share it with you. Thank you so much. We appreciate you joining us tonight. Please take care of yourself. Stay safe during this COVID period. And we look forward to having you join us for our next Zoom webinar regarding some other medical topic. Thank you so much.